Hello friends, let us now learn about the benign focal lesions. In focal solid splenic lesions, we are done with these malignant lesions, lymphomas, metastasis, angiosarcomas and hemangioperitomas. Now let us learn about the benign lesions like hemangiomas, hamartomas, littoral cell angiomas, lymphangiomas, sclerosing, angiomatoid nodular transformation, and inflammatory pseudotumors. So first, let us now learn about the hemangiomas first. In the benign lesions. So hemangiomas of spleen. Hemangioma, out of all the benign lesions of the spleen, hemangiomas are the most common primary benign neoplasm of spleen. So these hemangiomas are most commonly, they might be of two types. They are usually or most commonly, they are isolated lesions. Okay, that means only one hemangioma is present and they are not associated with any other symptoms. Or sometimes these hemangiomas might be a part of generalized conditions, like they might be a part of bigger spectrum of diseases. So these hemangiomas might be a part of hemangiomatosis, where there are many hemangiomas or many such type of lesions might be present, or they might be a part of a syndrome called as Klippel Trenaunay Weber syndrome. So these hemangiomas are associated with a part of generalized conditions, like they may be associated with hemangiomatosis or they may be associated with Klippel-Trenaunay Weber syndrome. So if you see on ultrasonography, these hemangiomas might look like they are actually well defined. They are well defined. Echogenic appearance is present. They are echogenic in appearance. They are almost similar to hemangiomas in liver. Okay, so they are well defined. Echogenous structures are present. Sometimes you might also see that these hemangiomas might have mixed echogenicity, may also be seen in some types. With along with this, based on the severity of complications or severity of cystic change, they might present with mixed echogenicity or cystic changes, or they might have foci of calcification might also be present in these patients. There might be mixed echogenicity, cystic changes, and foci of calcification might also be reported in a patient with hemangioma. So if you see the picture, this is the picture which is showing rounded echogenic lesion. So this is brighter than the spleen. So echogenic lesion is seen, which is hemangioma of spleen. Similarly, in the spleen, you can see multiple echogenic lesions. So these are echogenic lesions of the spleen, which are nothing but hemangiomas of spleen. Then we might also have some rare diseases also, like hamartomas. One more benign lesion is hamartoma of spleen. What does this hamartoma of spleen look like? This is the hamartoma of spleen. So this hamartoma of spleen is also a well-defined structure. Okay, if this is the spleen, here you can see the well-defined structure is seen, which is homogeneously. That means the whole structure will have the same echogenicity. Homogeneously, it is either isoechoic lesion, or you might see presence of mildly hypoechoic or mildly hyperechoic lesion might be seen. in hamartoma of spleen. Sometimes you might see presence of cystic areas may be seen inside the hamartoma, or you might see presence of coarse calcifications might also be seen in hamartomas of spleen. Okay, and if you do a color Doppler, hamartoma of spleen on color Doppler, this might show an increased vascularity might be seen in color Doppler in hamartoma of spleen. So this is the picture of hamartoma of spleen, which is showing a hyperechoic lesion. It is mainly hyperechoic lesion, and if you do a color Doppler, you will see that there is increased vascularity is seen in these tumors. The next benign tumor is littoral cell angioma. So the next benign tumor is littoral cell angioma. Okay, this littoral cell angioma here, these might look either as hypoechoic lesions or they might be hyperechoic lesions. They will have hypoechoic areas in the spleen. They will have both hypoechoic areas and they will also have hyperechoic areas also. Okay, and these littoral cell angiomas might also have a diffuse mottled pattern might also be present instead of having focal pattern. So they might have focal hypoechoic and hyperechoic lesion, or they might have diffuse mottled pattern might be present in patients with littoral cell angioma. So this is the picture of littoral cell angioma where you can see presence of, you can see both. This is hyperechoic lesion, and if you see this one here, you are seeing hypoechoic lesion. So you are seeing both hyperechoic and hypoechoic lesions are seen in the littoral cell angioma. Then okay, so after littoral cell angioma, the next benign tumor is sclerosing angiomatoid nodular transformation. In sclerosing angiomatoid nodular transformation, this is also a benign tumor of the spleen. Okay, this is a rare benign, it is a rare tumor, it is a benign tumor. It is also arises from vascular that is vessels, because angio, which is blood vessels. So it is rare benign vascular tumor of the spleen, and the lesion of this sclerosing angiomatoid nodular transformation is, it is seen as heterogeneously hypoechoic lesion. It is heterogeneously hypoechoic lesion, and it will grow, and thus it is difficult to distinguish from other lesions. It will grow and it is difficult to distinguish from other lesions, so it is difficult to diagnose on ultrasonography. So the main for the diagnosis of this lesion, biopsy is always required for diagnosis of this sclerosing angiomatoid nodular transformation. So if you see the picture, this is the picture which is showing the heterogeneously hypoechoic region. See, this is also a hypoechoic region. So here you can see presence of heterogeneously hypoechoic lesion is seen in this patient, and you can see that this heterogeneously hypoechoic lesion which is seen is nothing but sclerosing angiomatoid nodular transformation. Next. Okay, next we have the next benign tumor, which is actually an inflammatory pseudotumors. Okay, these inflammatory pseudotumors are also the benign focal lesions of the spleen, and these appear as a well-defined hypoechoic mass. These appear as a well-defined hypoechoic mass. So here, this is an inflammatory pseudotumor which is seen as a well-defined, obviously, and it is also hypoechoic. So it appears as a well-defined hypoechoic mass is seen in this patient. Okay, with inflammatory pseudotumor of spleen. So this is the picture of inflammatory pseudotumor of spleen on ultrasonography. So this is the picture of inflammatory pseudotumor of spleen on the CT, and this is the gross picture and this is microscopic picture. Thank you for watching.